On the off chance that you see records in regards to which nations have the best medical services framework, you'll probably see Sweden, Denmark, Canada, Germany, Switzerland, Japan, the Netherlands, and Singapore, someplace on the rundown. Yet how would they assemble such records? Indeed, considering is how much nations spend on medical care, the nature of that medical services, its accessibility. Furthermore, obviously, how viable it is and keeping the nation's crowded sound. Something else on the rundown is how much individuals could need to settle front and center for the medical care. All things considered, by any means, this is one reason you won't observe the USA on these rundowns with the American media, frequently telling us being debilitated in the US can bankrupt a family. Today we'll figure out how this occurs in this episode of the infographic Show Us Medical Services Framework Made Sense of. Before we start to make sense of the framework, we could inquire as to whether hospital expenses truly do really create such countless issues in the USA. As indicated by CNBC, that is for sure a reality, with one report saying doctors' visit expenses are the main source of liquidation in the country. What number of insolvencies? Nobody knows precisely. You'll discover a few insights expressing that around 650,000 Americans consistently fail in view of hospital expenses. President Obama said there was a hospital expense-related Chapter 11 in the US at regular intervals. However, that was way back in 2009. These numbers have been challenged, and doubters let us know there is something else to Chapter 11 in these cases besides doctors' visit expenses. Perhaps those bills were only the last thing that could possibly be tolerated. Yet, one thing we can take from the details, regardless of whether or not totally precise, is that America, a nation so created and rich, probably won't do a sufficient work taking care of its residents. The site, The Equilibrium, composed an exceptionally fair article on this subject. It arrived at the resolution that one should save in America as affliction or mishaps can prompt cosmic bills. The counsel it gives keep for later in an emergency clinic bed and carry on with a daily existence in accordance with not getting a disease regularly unavoidable, like diabetes. However, shouldn't a created country have well-being nets set up? That is an inquiry. Numerous Americans ask the number of Danes fail in light of the fact that they were sufficiently lamentable to be hit by a transport. We could review the new video that turned into a web sensation of her lady leg caught by a tram train in Boston. Try not to call a rescue vehicle. She cried as stunned onlookers saw her bone getting through her leg. Why, they asked, she answered, do you have at least some idea how much a rescue vehicle costs? So what's happening? The Division for Proficient Representatives lets us know this. The American Medical Services Framework is novel, essentially for a high-level country. That is for the most part on the grounds that the USA is the main industrialized country without all-inclusive medical care. That doesn't mean it doesn't spend a ton on medical services. As a matter of fact, it spends a great deal, a ton, around 17.9% of the GDP in 2016, or $3.3 trillion. We're informed that Americans search for healthcare coverage similarly as they look for anything more. Around 156 million Americans are guaranteed through their work, which is called manager-gave private protection. Then you have openly supported Medicare for old-timers in the crippled and Medicaid. For the unfortunate, its idea around 120 million Americans are important for these plans. That is the reason the framework has been known as a public-private crossbreed. However, when we talk about protection given or financed by managers, everything relies upon what sort of protection you have. It may not pay for everything. So certain individuals actually wind up failing. Then, at that point, you have the Reasonable Medical Care Act, or ACA, aka Obamacare, which endeavored to make it simpler for bosses to give better healthcare coverage plans for their laborers. It likewise made it conceivable to give the most extreme time limit for transient protection plans and make it feasible for bosses to give their laborers pre-tax cash to purchase their own inclusion. As we said, however, protection suppliers don't necessarily in every case give you precisely what you need. They for the most part have an organization of specialists or medical clinics, and you should utilize them. What's more, sometimes you are not generally covered for the treatment you really want. Previously, certain individuals with prior conditions couldn't bear the cost of their protection or were even denied it. which is only a piece of ferocious private enterprise. Obamacare was set up to forestall this, yet how about we return to protection? Whenever you pick an arrangement, you should take a gander at these things: deductibles, co-installments, co-insurance, and payments. The bundle you purchase, as per these things, would save or break you. You pay charges. Regardless of whether you make a case, these can be extremely high. Co-protection is a level of the expense you pay. A deductible is what you pay previously. Protection pays for anything, which can be basically as much as $10,000. A co-payment is what you should pay for each visit to the emergency clinic or facility. Also, you'll pay that before the insurance agency pays anything. So it is critical to pick the right arrangement. As one author puts it, you must be a chances creator on your own well-being. So consider the possibility that you have no protection. As we said, there are government-supported plans for those out of luck. Likewise, on account of the Crisis Clinical Treatment and Dynamic Work Demonstration of 1986. Emergency clinics can't simply dismiss you. Assuming you're at the specialist with blood erupting from your neck, there's additionally the Hippocratic vow, and that implies all specialists should attempt to treat you everything they can and manage it morally. Yet, on the off chance that you can't pay, there will be a bill. Also, to the US it will probably be an enormous bill that could prompt obligation gatherers coming for you. Your wages being decorated, some portion of the cash assumed out, your praise being demolished. Having an expense discount with well-being, somebody needing to take your home, or you could endure Chapter 11. However, without a doubt those with nice protection won't wind up in a seemingly impossible situation. Not as per the Kaiser family establishment that lets us know over 25% of American grown-ups with protection experience issues covering their hospital expenses. We are informed that 63% of Americans who have had these hospital expense misfortunes needed to burn through most, or every one of their reserve funds on those bills. One more 42% needed to find a second line of work. CNBC wrote in 2018, just 39% Americans have an adequate number of reserve funds to cover $1,000 emergency. Specialists let us know Americans ought to minimize their way of life on the off chance that they become ill. Regardless of whether they have protection, as failing could mean you probably won't get an advance once more, or have the option to lease a house or even find a new line of work. Sure, poor people and destitute could get government help. However, those that fall someplace in the not poor, but rather a long way from being agreeable class, are frequently the individuals who need to gamble with normal protection, and the chance of becoming ill destroying your life. Something else we're told is that 1 out of 10 Americans delay getting treated, on the grounds that they're stressed over the expense. That is the very thing you could call an endless loop, since holding up can simply exacerbate the situation. A few people couldn't in fact bear the cost of the deductible, in any event, when it's simply $500. The actual bills may regularly astound those that got treated. As per a story in The Atlantic in 2014, one man had a herniated circle, a medical procedure in America. He ensured he had sufficient money for the medical procedure. As the article expressed, $56,000 in medical clinic charge, the $4,300 anesthesiologist bill, and $133,000 expense for the orthopedist. In any case, there was an additional $117,000 for an associate specialist that it turned up. One would think at these costs, you could leave the emergency clinic fixed. However, in a Hugo supervisor suit with the keys to another vehicle and 2 passes to the following scene cup last. However, no, you sort out and leave with just a major bill. This is for the most part a result of authoritative expenses. This occasionally ludicrous expense of medications. The way that you pay for the chance of specialists being sued, paying medical services, laborers, compensation, new advancements, and clinical foundations simply charging you what they need. We're told by Perusers Condensation that a few emergency clinics charge $8 for a mucus recuperation framework. They're typically called tissues, and examination uncovered one patient was charged $53 per sets of non-clean elastic gloves. Sterile gloves were more all-out cost for the stay simply in gloves was $5,141. That plastic cup they use to give you your medications. $10 with a normal of $440 at cups for a patient stay in the emergency clinic. Liquor swabs of which you might require numerous, $23 a period. One individual was charged $137 for an 4-pack. The expense of that pack, $1. This is generally because of something many refer to as the charge ace, which permits clinics to charge unbelievable costs. These codex of expenses are emergency clinic explicit, meaning every medical clinic makes up its own costs. A few pundits have called such costs fiction and are incredulous of the absence of straightforwardness clinics give about this secret menu. Tell us in the remarks. Additionally, make certain to look at our other video. Thanks for watching. Furthermore, as usual, kindly remember to like, offer, and buy in. If you found this video helpful, make sure to give it a thumb up and share with your friend. Thank you for watching.